Hi everyone, my name is Mostafa and today I want to talk to you about retinoblastoma. If you've not seen me before, I'm one of the co-founders alongside Abigail Johnston of Bridging the Gap Academy. We are a medical education platform with an Instagram account, a Facebook account, and we have recently started a YouTube channel in the aim to bring the highest quality medical education content for you guys for free. We're also in the middle of developing courses for ophthalmology, for dermatology, and for general surgery. A bit about my background. I've just finished my FY2 training and I'm currently doing a clinical fellow job in Nine Oaks Hospital. I've also got a clinical honorary teaching role with the medical school teaching 4th and 5th year medical students. I've recently finished the first part of the ophthalmology fellowship examinations which ophthalmology trainees need to do. During medical school, I came 5th in the National Duke Elder Examination of Ophthalmology, which is a competitive exam and it ran across the UK with 370 students competing. In doing so, I've learned a lot of ophthalmology knowledge, and I hope to share as much of that knowledge with you guys for free. If you're interested in taking the Duke Elder exam, I've also published a book called The Duke Elder Exam of Ophthalmology and a Comprehensive Guide for Success, alongside one of my colleagues, Omar Khalil. This is an excellent book with 180 questions to test yourself as well. The reason I want to talk to you today about retinoblastoma is it's the most common intraocular tumour of childhood. It's a scary topic and not many people know much about it. If you're a GP or if you're a medical student or junior doctor, you need to be aware of some of the clinical signs, some of the easy signs to pick up so that we never miss a child of retinoblastoma, because if picked up early, it has over a 95% cure rate. As we've said, retinoblastoma is the most common intraocular tumour of childhood. It's present in about 1 in 18,000 births, and it accounts for 3% of childhood tumours. Most of the time, or actually 60% of the time, this tumour is unilateral, and 40% of the time it can happen in both eyes. Now, the median age of diagnosis can vary if this is an inherited condition, as in there's some genetic trait behind it, or if it's sporadic. If this is a heritable tumour, then it occurs in children less than 12 years of age commonly. However, if it's sporadic, it can occur on average at a median age of 24 months or 2 years. Now let's talk about some genetics. It arises from embryonal photoreceptor cells of the retina, and it's because of a mutation in the tumour suppressor RB1 gene. This is found in the long arm of chromosome 13. Most commonly occurs sporadic, however it can be inherited in an autosomal dominant fashion. When we diagnose this tumour, the most common symptom is a loss of red reflex, or actually a white reflex, something we call leukocoria, as you can see on the image that just appeared right now. This is usually noticed on taken photographs, so parents of child will have taken flash photography of their kids and they'll have noticed that one eye appears white and one eye appears red. Now, if anyone comes to you with this sort of presentation, this patient needs to be referred urgently within 2 weeks to an ophthalmologist. The second most common presentation is a childhood squint or strabismus. This could be in the form of an esotropia, so an inward eye that goes out on cover test, or it could be the other way around. Other common presentations are reduced visual acuity, nystagmus of the eye, and the front of the eye may look a bit red, although this is very non-specific. As an ophthalmologist, you will need to do a dilated fundoscopy, so you dilate the patient's eye and you have a look at the back of it. And what you might see is a white, round retinal mass. And this mass can grow in either one or two directions. It can grow towards the vitreous, so endophytic growth, or it can grow towards the RPE and the choroid, which is called exophytic growth. Now, a characteristic feature of retinoblastoma, which you might see in your exams, is calcifications. So within these lesions that you see through fundoscopy, or particularly through an ultrasound scan, then you might see something called calcifications. And in an ultrasound, you will also see high internal reflectivity. And this calcification is actually very specific to retinoblastoma. If there's no calcification, it might not be a retinoblastoma, and it might be a confusion with some other cause of loss of red reflex in a child, such as toxocariasis. This is not the only differential in a white eye in a child. Other differentials include cataract, but this is probably the most sinister differential, so we must always rule this out. Treatment of this condition does not always involve inoculation or removal of the eye. If picked up early, external beam radiotherapy may be of benefit. Now, treatment is very specialized and it only happens in some specialized centers, and so I won't delve into this. I've now come to the end of the video. I hope you've enjoyed it and I hope you've learned something. If you want to watch more videos such as this and learn more information about ophthalmology and other medical student content, then please give this page a like and please subscribe to our channel.